Hello, my name is Jones, and today we are looking at the hepatic coma. Hepatic coma is at times known as the hepatic encephalopathy. Okay, so to begin this lesson, the liver is a cardinal body organ responsible for various activities in the body, such as excretion and removal of waste products from the body. When the liver fails to perform its function of excreting waste from the blood, the toxins will accumulate in the blood and are supplied to various parts of the body, including the brain. So when these toxins are transported to the brain in the blood, the brain's function starts to decline. So when the brain fails to function, the patient will go into a coma. Okay, so of course this is why we call it hepatic coma, because it is coming as a result of failure of the liver to remove excrement. Hence, the liver fails and the brain becomes intoxicated with a lot of toxins. And once it fails, then they go in what we call hepatic coma. So by definition, hepatic coma is the loss of brain function following failure of the liver to excrete excess toxins from the blood, and it's characterized by fever and the coma itself. Or you can still define it as a decline in brain function occurring as a result of severe liver disease. So that is what we call hepatic encephalopathy or hepatic coma. So with that discussed, let's look at some of the functions of the liver. So the liver has got a lot of functions, but we're just going to mention just a few, about 10. So the liver helps in blood detoxification. 2. Excreting of bilirubin. 3. Synthesis of plasma proteins. 4. Formation and excretion of bile. 5. Synthesis and storage of clotting factors. 6. Storage of glycogen. 7. Metabolism of fats, proteins and carbohydrates. 8. Enzyme activation. 9. Excretion of ammonia. 10. Storage of blood. Okay, so the liver has all these functions. So if it fails to detoxify the content within the blood, then that content accumulates in the brain and causes the brain to fail, bring about hepatic encephalopathy. So what are some of the causes of hepatic coma? So the causes that are direct, that directly cause that bring about this problem are not known, but liver failure is the major cause. So when the liver fails, that becomes a major cause of hepatic coma. All right, but the risk factors that we have include trauma. This may be due to the rupture of the liver or the liver blood vessels, making it fail to function and perform its functions. Then other reasons could be age. There couldn't be degenerative changes to the liver, hence weakening it to remove the toxins. Okay, so degenerative changes that happens to blood vessels within the liver may cause it to weaken and fail to work. Then tissue necrosis. And necessarily here we mean the tissue, the liver itself. So this may cause inability of the hepatocytes, so thereby the integrity is lost and then it fails to perform. So tissue necrosis of the liver. So then the other thing is chronic liver disease. If someone has had a chronic liver disease like liver cirrhosis, it may damage the liver severely, causing a failure of the liver to work. Okay, other causes of hepatic coma include infections of the liver or general infections of the liver. Okay, so general infection of the liver causes inflammation and eventually formation of abscess that may alter the normal liver function. All right, so now let's look at types of hepatic coma. So the types are divided into 2. So we have hepatocellular Okay, hepatic coma. This type occurs as a result of severe damage to a significant part of the hepatic cells in viral hepatitis. So other causes include intoxication with chemical poisoning and following fungal infection. Then we have shunt hepatic coma. Okay, so in shunt hepatic coma, this is also called the bypass hepatic coma. It occurs when outflow of blood from the intestine passes not through the liver. So this causes liver ischemia leading to tissue necrosis. So the two main types of hepatic coma is hepatocellular hepatic coma and then the shunt hepatic coma. Okay, so now let's look at the stages of hepatic coma. So the stages, we have the pre-coma stage. Okay, so this is characterized by impaired orientation, thinking, sleep disorder like drowsiness during the day and wakefulness at night. Then the second stage is threatening hepatic coma. In this type we have confusion. Attacks of excitement are replaced by drowsiness and depression. There is a disorder of coordination of movement, tremor in the finger, and speech becomes disturbed. Then the third stage is developed hepatic coma. This is characterized by a complete lack of consciousness and rigidity of occipital muscles. There is progression of jaundice, the body temperature rises, sepsis often actually comes in, and oliguria develops and leukocytosis can also be seen. Okay, so with these stages, okay, with these stages or phases within stages of hepatic coma, okay, we can now look at the stages of hepatic coma in this following fashion, also to do with the 5 stages of hepatic encephalopathy according to the West Haven criteria. So according to West Haven criteria, we have stage 0. At this stage, symptoms are minimal. Okay, then stage 1, symptoms are mild. They may include the shortened attention span and changes to sleeping habits such as insomnia. Okay, so again, stage 2, according to the West Haven criteria, it includes stage 2 symptoms that are moderate, and at this stage there is feeling of disorientation or lethargy. Okay, then stage 3. Then stage 3 symptoms are severe. There is inability to perform basic tasks, and there is feeling of confusion and experience of personality changes. Then stage 4, this stage is characterized by patient now in a deep coma. Okay, so some of the nursing considerations as you are nursing this patient is that you need to draw up some aims for your nursing care. You need to look at the following elements within your nursing care, like environment, maintenance of clear airway, observation, psychological care, rest, pain management, and care for the fever. Medications also, it's something that you have to look at to avoid further slip into the coma and death of the patient. Infection prevention is important. Nutrition can also be taken care of, elimination and education to the patient as they recover. So in the management of the patient, we can do investigations and they also come up with a diagnosis. So under the investigation, so we have history taking. Okay, this will review risks such as prolonged and excessive alcohol intake. Then a physical exam, which may show some symptoms like jaundice, ascites, or pain when palpating the liver. Okay, then 3 liver function tests. The liver function test may show raised enzyme levels that signify stress on the liver. Then complete blood count can also be done, which will show raised leukocyte levels, and the red blood vessels may be reduced, including the clotting factors. You can do the scanning of the liver, and it will show changes in the contour and size of the liver. Okay, so to do with pharmacological management or treatment, patient may be unconscious, or patients will be unconscious because they are in a coma. So oxygen therapy in cases of breathing difficulty can be administered. Antibiotics such as gentamicin and benzylpenicillin intravenously can be given. Remember, in parenteral drugs work faster. So for unconscious patients, here we are saying gentamicin and benzylpenicillin. Then lactulose is given. This enables the liver to rest. Okay, so lactulose is a very important component amongst the drug management that is given. Then if all fails, then liver transplant can be done, and blood transfusion in cases of severe anemia can also be given. Patients also need to be taught about the diet when they have liver condition, as it also may help improve the condition. So reducing on excess intake of protein can also help, and also reducing on excess intake of fat can also help the patient to recover by reducing the stress on the liver. Okay, patient can increase carbohydrate uptake as it helps for the patient to have energy. Drugs, patient needs to be aware that some drugs may worsen a lot of stress on the liver, so some drugs need to be avoided. Okay, so signs and symptoms. Signs and symptoms of hepatic coma may include fever, which is related to the infection, jaundice, which is related to failure of unconjugated bilirubin excretion, then ascites, which is related to excess protein insufficiency, confusion, which is related to brain intoxication, headache, which is related to cerebral hypoxia, hallucination related to cerebral hypoxia, bleeding tendencies, which are related to insufficient blood clotting factors, weaknesses related to glucose insufficiency. Then there is also severe abdominal pains related to overactivity, and tremors that are related to excess toxins in blood. Okay, so the waste products accumulate in the blood and are transported to the brain, causing brain intoxication. Okay, so as they are done that, then they will cause tremors, which are related to excess toxins in the blood. Let's now talk about the pathophysiology of hepatic coma. So in the pathophysiology, it's important to remember that pathophysiology is about etiology, physiology, then pathology, signs and symptoms, and possible complications. In that fashion, that's how we look at pathophysiology. So the liver is responsible for the excretion of the waste products from the blood, like urea, ammonia, and creatinine. Following excessive alcohol intake, so alcohol being the cause of this intake, the liver is damaged and eventually fails to excrete waste from the blood. So the waste products accumulate in the blood and are transported to the brain, causing brain intoxication. So symptoms like confusion, headache, jaundice, hallucinations, eventually these can be seen as the brain fails to function normally and the patient slips into a coma. So in pathophysiology, it's important that we're looking at the cause. Here we picked alcohol intoxication. Okay, the normal physiology of liver is to bring about detoxification. The pathology here is the accumulation of toxins. Okay, toxins that affect the brain normal function. Then the signs and symptoms that are coming in: confusion, headache, jaundice, hallucination, and the rest. Okay, so now it's also important that we know that this disease is preventable. So the disease is preventable through the following means: avoid excess alcohol intake, avoid and reduce on excess fat intake, maintain a good weight, vaccination against diseases like hepatitis, and also early treatment and diagnosis of liver disease. So these can be used for prevention. Okay, so we have been discussing hepatic coma as a condition, okay, which is also known as hepatic encephalopathy. So hepatic coma comes about as a result of continued increase of metabolic waste that was supposed to be removed by the liver. Okay, so these waste accumulate, affecting the brain function. So when you say hepatic coma, we are just looking at the loss of brain function following a liver condition. Okay, that will be characterized by fever and the patient sleeping in the coma. So the liver has many functions, and what is bringing about a coma is that the detoxification process is not taking place. Hence, there will be accumulation of a lot of products within the blood. So these are the products that will cause the brain to fail. So the direct cause of hepatic coma is unknown, but risk factors include trauma, age, tissue necrosis, chronic liver disease, and infection of the liver. When we talk about types of hepatic coma, we have hepatocellular hepatic coma and shunt hepatic coma. When we talk about stages, we have the pre-coma, threatening hepatic coma, and developing hepatic coma. Then stages of hepatic coma, according to Westhaven's criteria, we have stage 0, stage 1, stage 2, and stage 3. Okay, and lastly stage 4. So stage 4 being the coma stage, if you know the levels of unconsciousness. So this is where this is drawn, but here it is specific to hepatic coma. So stage 3, we are looking at it as more as the stuporous stage, where symptoms are severe, inability to perform basic tasks and the like. Stage 2, we are looking at it as patient being disoriented. So symptoms are moderate, but at this stage there is feeling of disorientation. Whilst stage 1, symptoms are mild, okay, but patient may have sleep problems with sleeping and insomnia. Then stage 0, here we are just saying we have minimal symptoms, or the disease that is causing is in situ, so we do have just minimal symptoms to effectively say that now this is the hepatic coma. Okay, so how to prevent? By prevention is we remove the cause. Once we remove the cause, if it is avoiding trauma to the liver, then we would have removed. Avoiding drug abuse, then we are also sparing the liver. So you have to avoid drug abuse of alcohol. Okay, then avoid and reduce excess intake of fat. Do with that, explain a good, about you can maintain a good weight, vaccination, and also early treatment of underlying liver condition. So there we have it. Please, we are talking about hepatic coma, and I'm saying please keep studying and have a great day.